Eyelid rejuvenation involves optimizing the aesthetic of the eyes. So really the eyelids are framing the beautiful structures of the iris, and within the face, it's the most capturing aesthetic feature. So it's an interplay between your eyebrow position, how prominent the frontal bone is, where your eyelid sits, how high your eyelid crease is, how your lower lids sit relative to the shape of your eye. So eyelid rejuvenation is a concept that varies from person to person depending on your ethnicity, your age, your very specific anatomy. But in an essence, when we want to optimize the rejuvenation aspects of the eyelids, we look at skin care, we look at injectables, lasers, and then certainly surgical options. And some patients need one of the above, and others would benefit from a combination, which is customized to the unique needs of every person. Eyelid rejuvenation is certainly appropriate when the eyelids start to descend to the point where they're blocking vision. So in our practice, we have patients where the eyelids have come down so much that patients are having difficulty seeing. They have to use their eyebrows to lift, and when they're reading and doing any type of regular activities, they find that the eyelids are actually a hindrance. So in those cases, surgery is a great option, and we do that for men and women. Otherwise, with rejuvenation of the under eye area, skincare products, injectables, fillers, those are other treatment options that are appropriate at various ages depending on what the unique needs are of every individual and exactly what we're trying to achieve. So rejuvenation is a concept that's very personal, and when you come in, we'll talk more about it, and we can give you all the options from the least invasive to surgery, which certainly is a very effective option. After injectables around the eyes, typically you can expect some redness, some swelling. This is a very short duration. If it's purely botulinum toxin, you can typically go right back to work, and most people would not even realize that you had anything done. If you're getting an injectable filler, depending on how much is injected, it really varies from person to person. You may have some swelling. So the first 3 days to a week, you may notice that there's actually a little more volume, a little bit more fluid in the area that's injected, and that tends to subside over the following several weeks. And there are some unique nuances depending on which filler we use and where it's injected. After eyelid rejuvenation surgery, you do certainly want to take a little more time for yourself. I tell patients, take the first week off. You're going to be home, you'll be icing, you'll be relaxing. I have had a few patients who've pushed themselves and gone back to work that first week, so it's possible if you really need to, but otherwise we recommend the first week you're relaxing. You can expect about 90% of the healing will be evident within the first 2 weeks, and then the final 10% always takes a couple of months. No matter how healthy you are, it's just the way the body heals.